Hey everybody, this is Tony Taylor here, currently from the state of Georgia. I'm living here with my wife and my two beautiful daughters, my teenage daughters. I am in the professional counseling degree. My understanding it soon will be changed the name into clinical and mental health degree. And so, however they want to call it, that's fine with me. I was looking up the license requirements in the state of Georgia, and according to the Secretary of State website, the sos.ga.gov, according to that particular website, it says that any person seeking licensure must go to an institution or a college that has certain accreditation. The accreditation is the Counseling on Accreditation of Counseling and Related Educational Programs, or the Council on Rehabilitation Education, also known as KCREP accredited or CORE accredited, and that if the institution is accredited by these two particular things, they don't have to be both of them, just either or, then educationally we have met the requirements for licensure. Basically, it needs to cover the 8 program areas that KCREP is talking about. Specifically, those areas are professional counseling and ethics, human growth and development, multicultural diversity, human growth and development, counseling techniques, group dynamics in counseling, career counseling, research methods, and psychopathology. Actually, and after September of 2018, they've increased the requirements for internship to at least 600 hours, which I believe is exactly what this particular program offers, and at least 100 hours of a practicum. There is a license that state of Georgia recognizes called a licensed associate professional counselor, an LAPC. An LAPC can actually sit for their licensure right out of college. Everything that they have prepared for, the education, the requirements in the internship, the practicum, already sets them up ready to go for licensure as an LAPC. During that time frame, while you are licensed as an LAPC, you can work in a primarily counseling setting, giving counseling services to clients under supervision so that one can become an LPC, a licensed professional counselor. The person who's desiring for an LPC must sit under another LPC who is fully approved and in good standing with the state and offer elements of counseling that is supervised and unsupervised. It is up to 3 years of supervision that must be approved, of postmaster's supervision. It has to be approved by an LPC. It goes on to say that to qualify for licensure as an associate professional counselor, the applicant must pass, or for even an LPC, the applicant must pass a required competency examination prescribed by the board. That's what the SOS website says. It doesn't say any other definition about what examination is needed. It literally just says, and I quote, to qualify for licensure as an associate professional counselor or a professional counselor, an applicant must pass the required competency examination for licensure prescribed by the board. There's really no other definition that is offered. However, according to nbcc.org, that there is a particular licensing examination for the state of Georgia known as the NCE, the National Counselor's Examination. It does not state that the other examination is necessary, and I believe it's the NCH or MHCE, I think is what it's called, the NC National Counselor's Mental Health, National Clinical Mental Health Counseling Examination, something like that. But the state of Georgia doesn't need that one, just the NCE. However, I am considering on a personal note that I'm going to take both examinations. And the reason being is I would like to be considered to be a TRICARE approved provider, which I understand, according to the NBCC website, that I would need to have the formerly mentioned examination as well, not just the National Counselor's Examination, but also the National Counselor's Mental Health for Clinical Examination, the NCMHCE. I would need to have both of those, and so that's something that for me personally that I would like to have accomplished. In the state of Georgia, there are a few areas that they actually license. Like I already mentioned, it was the Licensed Associate Professional Counselor, the LAPC, the LPC, the Licensed Professional Counselor. We also have the LMSW, Licensed Master Social Worker, the Licensed Clinical Social Worker, the LCSW, the Licensed Associate Marriage and Family Therapist, LAMFT, and then the LMFT, the Licensed Marriage and Family Associate. There's really no tiers that is involved. And according to the state code, the OCGA 4310A, the Georgia state law gives the Secretary of State the right to govern over all counseling professions and to define the scope of practice that we can, as counselors, give. The board governs the LPC and the LAPC according to the state laws, and it states that the counselor may test, diagnose, treat, and deal with people in the state of Georgia that has mental health concerns, leading them to mental health wellness. This means that a counselor can use any test, assessment, or any other criteria that's contained in the standard realm of diagnostic systems in the mental health field. It includes everything except the diagnosis of a neuropsychological disorder. So LPCs cannot diagnose neuropsychological disorders. The LPC and the LAPC can actually utilize techniques of principles or methods of procedures in counseling to help different people and clients within the counseling field. Specifically, it means that we can help resolve personal issues, social issues, vocational issues, intrapersonal and interpersonal issues, helping people in the utilizing psychotherapy to treat and to diagnose and to treat people working with mental health disorders, emotional disorders, substance abuse disorder, domestic violence disorders, educational assessments, developmental disabilities, and other similar and related disorders. The counselor in the state of Georgia can utilize group and individual techniques in cognitive behavior and to help with the changes to facilitate mental health wellness. The article is very clear as to say what counselors can do. It utilizes, but is not limited to, a type of language, leaving some room for interpretation for exactly what is their scope of practice. For example, it'll say things like the counselor can practice mental health wellness and utilize any vital diagnostic or technique that is necessary. In doing so, that leaves it open for a wide realm of interpretation, in my opinion. What's very unique about this is the fact that the counselor has that unique interpretation, that it gives us the ability to actually diagnose and to treat and to use techniques and to involve ourselves in this really dynamic relationship with our clients so that we can help provide better health and wellness to them. This is what I found when in researching what it means to be an LPC. My desire is to be an LPC in the state of Georgia. I'm hoping that one day that the portability of my state, of my licensing, will be something that is ubiquitous across the states, because I am from the state of California, and one day, possibly, in the not so near future, I would like to travel back to that area so that I could actually utilize the techniques there as well. But my understanding is that the state of California has other requirements that currently is not involved with the state of Georgia. So who knows? It might change, it may not change. And I'm just kind of getting into this. So the more knowledge I get, the more experience and exposure I have, I might actually get to a point that I know exactly what to do. Anyways, this is my video blog. Leave me some comments and some questions for me. I'll try to answer them. Again, my name is Tony Taylor. I am from the state of Georgia, and I desire to be an LPC. Thank you.